how do we rejuvenate the upper and lower eyelids but keep them natural and expressive at the same time? This is a very important question because this is really sub-millimeter surgery where a tiny adjustment can make all the difference, whether you're dealing with a brow lift, upper eyelid surgery with an upper blepharoplasty, or lower eyelid surgery, or fat transfer in the zone. One of the things that's absolutely important is to understand that volume should be preserved. In the past, and even sometimes now, there are surgeons who take too much fat from around the eyes, and all this does is leave them looking hollow and sunken. This is not anywhere moving the eyelids in the direction of youth. In fact, it's moving them in the direction of age. I think those of us who are serious about eyelid surgery are moving more and more in the direction of fat preservation and being very judicious in our removal of fat. Along with that comes the understanding that sometimes it's important to add volume because as we age, the framing zones around the eyelid, the upper cheek, the area beneath the brow, can really hollow out, and sometimes it's really quite magical when you add a little volume to these areas, what it can do to rejuvenate the entire area. We also need to look at tone of the eyelid. There's the deep tone, which comes from the foundational support, and if that gets loose, we need to tighten it both from an artistic and a functional standpoint so we keep the eyelid margin in good position. But also sometimes the muscle of the lower eyelid gets a little slack, and so we need to tighten it up as well. If we respect these principles and follow them, we can produce a very natural result for our patients that does not look operated.